if you've been diagnosed with an L4-5 or an L5-S1 disc bulge, disc herniation, or degenerative disc disease, chances are you've already been dealing with pain and frustration for months, maybe even years. You may have gone through traditional chiropractic, physiotherapy, or other treatments only to find that the pain still lingers. And if you've had x-rays or an MRI, you've probably seen firsthand the structural changes happening in your spine. As an advanced certified chiropractic biophysics chiropractor, I've taken specialized training in the non-surgical restoration of the spine and discs. My focus is not just on pain relief, but on helping you rebuild strength, stability, and function without resorting to surgery. In this video, I'm going to show you 3 essential mobility exercises that I prescribe for my patients at the beginning stages of disc rehabilitation. These exercises are designed to gently restore movement, reduce stiffness, and begin the process of healing your spine. If you're feeling stuck and unsure of where to start, this is the first step. Let's begin. This is the first variation of the pelvic tilt exercise. This is for anyone with a lower disc issue, so an L4-5 herniation or L5-S1 herniation. So this is the lying portion. So this is the one that most of my patients enjoy the most because they're laying down and it's easier to isolate. So Katie, can you show that pelvic tilt exercise? So she's pretending like she's driving her belly button down towards the floor and really rotating. I'm going to get my hand in here. So she's really rotating the pelvis here. So can you explain a little bit about what you're feeling there, Katie, when you're doing that?
Feeling my back flatten against the table.
Okay, good. That's a good cue.
And my abs crunch together.
Okay, so shortening the distance between your rib cage and the top of the pelvis. Good. And that other cue that she said was pushing her lower back towards the table. Thanks, Katie. This is the same exercise, only standing. So Katie has got her heels out from the wall, about a foot. And then, Katie, if you could just demo the exercise. Same idea, she's pushing her belly button towards the wall, flattening that spine out along the wall, and rotating the pelvis up. So sometimes people feel a little more comfortable standing, or sometimes it's just not practical in your workday to find a place to lay down. Okay, Katie's going to do our final variation here, seated. And she just mentioned before we started here that this is a tougher position compared to the other two to really isolate. So go ahead, Katie. So forward flex, extend back, forward flex, extend back. Certainly if you are able to stand or able to lie down, it's going to be more effective for you. But if you sit in an office chair all day long, you'll probably have to opt for this option. It does increase the mobility in that lower spine though, so it's better than not doing anything. So these next 2 variations are variations of the McKenzie exercise series for herniated discs. So you started on your tummy, and first one is you just bring yourself up to your elbows and you hold that. And that's putting a nice deep lordosis into the lumbar spine, opening up that disc on the front, hopefully relieving some of the pressure on that nerve. The second variation of this would be where Katie comes right up on her palms. Now again, I remind you, she is super flexible. You do not want to try to do this if you're having a lot of stiffness in there, but this really accentuates that lumbar lordosis. You want to hold that for about 30 seconds and then just let yourself down nice and gently. This is a great mobility exercise. We just call it the cat-cow. So Katie, if you can do that exercise for us. So you're going to fully extend. You're getting a really nice deep lordosis here. So you're flexing that lumbar spine, and then she's going right into extension, flexion, and extension. Now she's got great mobility. So if you do have an injury, don't expect to go all the way up. But if you hold that bottom and top, you'll get a great stretch and it'll help decompress that disc. I hope you find these exercises helpful. Always perform them within your pain tolerance. If you have questions or topics you'd like me to cover, leave a comment below. Don't forget to subscribe and turn on notifications to stay updated on new videos. To learn more about corrective chiropractic care, visit 100plusliving.com for my blog, or reach out to me personally at 100plusliving@gmail.com. You can also check out my 100 Plus Living series of books on Amazon. I'll leave a link in the comments below. Talk soon.